Hello, my name is Janice Imbriano. I am a certified nurse case manager. It is with great honor to represent case management and our role in discharge planning of stroke survivors. This is a photograph of the nurse case managers and social workers celebrating National Case Management Week. National Case Management Week begins in the month of October. I would first like to discuss the nurse case manager responsibilities. We visit the patient during hospital stay to evaluate your discharge planning needs. We assist in coordinating your treatment care under your physician. We review your medical chart and communicate with your insurance carrier to obtain insurance coverage for discharge planning needs. We make appropriate post-hospital referrals, such as home care, visiting nurse services, physical occupational speech therapies, outpatient services, subacute rehabilitation, durable medical equipment, and transportation. Post-hospital care options. Number one, home care. Provides intermittent or continuous services such as skilled nursing, home health aides, and physical, occupational, and speech therapies for patients who are homebound. And insurance coverage requirements vary depending on insurance carrier and medical needs. Outpatient services provide medical care that does not require overnight stay, such as same-day surgery, cardiac rehabilitation. Outpatient physical or occupational therapy services, physician's prescription is required. Continued post-hospital care options, medical equipment and devices. Devices such as walkers, bedside commode, tub benches, wheelchairs, oxygen, and tracheostomy supplies. Transportation. Transportation is usually not a covered benefit under most insurance plans except Medicaid or managed Medicaid. The nurse case manager can advise on coverage guidelines and prices for ambulances. Hospice. Hospice provides a team approach to terminal care. The emphasis is on comfort and relief from pain. Physician's orders are required. Continued post-hospital care options. Community resources, home delivered meals, Meals on Wheels, emergency phone response system, adult daycare, and respite programs. We also have the Zufall Clinic for uninsured, low-income families and single adults may qualify to receive low-cost or free health insurance medical care. The Zufall Health Clinic, located closest to the Cooperman Barnabas Medical Center, is located on 95 Northfield Avenue, first floor, Suite 2, West Orange, New Jersey, 07052. The telephone number is 973-891-3425. Patient requirements: to bring the Social Security number or permanent resident green cards, previous year's income taxes, current employer information, and proof of income. I would like to discuss the role of a nurse case manager in discharge planning of stroke survivors. The nurse case manager plays a significant role in discharge planning of stroke survivors. She is a link between the patient, families, and multidisciplinary team. Families are hesitant to take care of stroke patients at home, so the nurse case manager educates and trains the patient and families to take care of stroke survivors at home. We coordinate with the multidisciplinary team to provide all necessary facilities at home, which eventually decrease length of stay and cost burden on families. Stroke is the third leading cause of death and the leading cause of long-term disability worldwide. Individuals with strokes have problems with mobility, swallowing, language, communication, and performance of daily life chores. All stroke patients leaving the hospital require formal discharge planning, keeping in view their social background, physical, psychological, and functional status. The process of discharge planning started at the time of admission, but it is carried out once the patient is medically stable to be managed at home. The purpose of early discharge planning is to maintain benefits of rehabilitation and prevent patients from nosocomial infections. Hence, in third world countries like Pakistan, when there is no stabilized nursing care and equipment at stay, they are dependent and can be bedridden. The nurse case manager plays a significant role in discharge planning. The role functions of the nurse case manager include care coordination, facilitation, education, advocacy, resource management, focusing on positive outcomes, and discharge planning. Nurse case managers are trained to eliminate frustration, confusion, unnecessary delays, and to help patients go smoothly through their recovery process as smoothly as possible. The nurse case managers conduct formal sessions with family members, 3 to 4 days prior to discharge in order to discuss appropriate place to live after discharge, nursing care assistance, and special equipment required at home. We also arrange rehabilitation services at home, training, and education of the caregiver. The nurse case manager provides a list of equipment, names, contact numbers of medical surgical supplies, and shops that will be needed at home. The families who cannot purchase equipment, we will provide contact of welfare trust who can give equipment on rent or deposit. Nurse case managers make sure that the patient and families are imparted detailed information about rehabilitation at home and coordinates with occupational therapists, speech language pathologists to teach patients and families about required care at home. At the time of discharge, follow-up appointment is also provided to them. The nurse case manager is responsible to teach one person among the members of the family regarding all patient care that is required. We make sure that the caregivers understand the physical and emotional needs of stroke survivors. At the time of discharge, the nurse case manager explains about the prescribed medications and its side effects, hygiene care, dietary precautions, rehabilitation program, communication, follow-up, and other health practices. In the nursing profession, it is not limited to bedside nursing, but now nursing has widespread scope and nurse can play different roles in which the nurse case manager has a significant importance worldwide, and we should promote this magnificent role. I wanted to say thank you. My name is Janice Imbriano. I'm a certified nurse case manager and discharge planner. If there's any questions, I would be more than happy to answer and address any discussions. My number is 973-322-2246. The nurse case management and discharge planning main number is 973-322-5055. Our case management hours range from Sunday to Saturday, 8 a.m. to 4 p.m.